Welcome to The Explainer. Today, we're diving into something that could be a real game changer in implant dentistry. We're talking about using AI to tackle a huge headache, the inconsistent diagnosis of peri-implant disease.
And what we're looking at today comes straight from a 2025 paper in the Journal of Dental Sciences. The research from Yicheng Mao and his team introduces a pretty slick automated framework designed to solve this very issue.
Okay, first up, let's talk about the diagnostic dilemma. And, this is a challenge that every single clinician who works with implants is going to be very familiar with. So let's be honest for a second. How consistent is the diagnosis of peri-implantitis in your own practice? I mean, we all know that assessing bone loss around an implant can be tricky, right? But the real question is, just how much does that assessment vary? From you to your colleague, or even for you, from Monday to Friday? And that's really the heart of the problem, isn't it? Peri-implantitis is a huge deal. It can lead to implant failure. But our go-to diagnostic tools, radiographs and probing, they're really subjective. What I see and what you see might be totally different. And that leads to this huge variability between examiners. The classification systems are so complex, they're honestly tough to use in a busy practice. So the bottom line is, we desperately need something more objective, something more standardized to help us out.
So that brings us to Section 2, an AI-powered second opinion. And this is where things get really interesting, because the study's solution isn't about replacing the clinician. It's about giving us a powerful new assistant.
Yeah, I mean, the authors really hit the nail on the head with this quote. They're not trying to create some kind of robot dentist. They've built an automated framework to act as a reliable second opinion. The goal here is all about support, making our clinical decisions stronger and, honestly, making our day-to-day work a whole lot more efficient.
Okay, so let's get into the nuts and bolts of it. Section 3, Anatomy of the Algorithm. How does this thing actually work? How does it go from a simple radiograph to a specific diagnosis? Let's break it down.
It's actually a really elegant four-step process. First, the AI, it's a model called YOLO V8, by the way. It just automatically finds the implant on the radiograph. Super quick. Then, step 2, it analyzes the image. It maps out all the little implant threads and figures out exactly where the alveolar crest is. Step 3 is the measurement phase. It quantifies the bone loss by calculating the percentage of threads that are exposed. And finally, it classifies the implant, giving it a severity grade based on that number. The whole thing is done in the blink of an eye, turning a subjective image into hard data.
And the result you get is beautifully simple. The AI spits out one of three grades. Grade A means you're looking good, not much bone loss, less than 25%. Grade B is moderate, so between 25 and 50%. And grade C, well, that's severe, 50% or more. What's so great about this is that it's a clear, standardized result, no guesswork. You can take that and immediately factor it into your treatment plan.
All right, Section 4, putting the AI to the test. So this all sounds great in a lab, right? But the real question is, how does this AI actually perform when you put it head-to-head with experienced clinicians? Let's dig into the data. Okay, get ready for this first number because it's pretty mind-blowing. The AI was 36 times faster than the human experts. 36! We're talking about the AI taking less than a fifth of a second to do its thing, while the manual assessment took, on average, over 6.5 seconds. That is a massive difference.
But here's the kicker. It wasn't just faster, it was also more accurate. The AI actually boosted diagnostic accuracy by 7.5% compared to the experts. So, faster and better.
And when you look at the numbers side by side on this table, it's just crystal clear. The average time for the AI, 0.183 seconds. For the expert, over 6.5 seconds. And accuracy, the AI hits over 96%, while the manual evaluation is just under 89%. Is that 1-2 punch of incredible speed and superior accuracy that makes this technology so compelling.
Okay, so let's bring this all home. Section 5, your new digital assistant. What does this actually mean for you in your practice on a Monday morning? What are the real clinical takeaways here?
Well, the potential benefits are pretty huge when you think about it. First off, speed. Imagine how much time you'd save on radiographic assessment, time you can spend with your patient. Then there's accuracy. You're getting a more precise look at bone loss. And objectivity. This gives you a data-driven second opinion, taking some of the guesswork out of it. All of this helps streamline your workflow, letting you focus on the cases that really need your immediate attention. Oh, and it could be an amazing training tool for newer dentists, too.
But of course, we have to be realistic. This isn't a silver bullet, at least not yet.
there are some important limitations to keep in mind. The big one is image quality. If you feed it a blurry or poor quality radiograph, its performance is going to drop. Also, the model was only trained on a data set from one hospital, so we need to see if it works as well on a broader range of images. And maybe the most important point of all, this is designed to be an assistant. It's a tool to help you, not replace you. Your clinical judgment is still the final word.
So when you put it all together, this study really does give us a fascinating glimpse into the future, doesn't it? It shows how AI isn't here to compete with us, but to augment our own skills with incredible speed and accuracy. Which leaves us with the big question, right? Is AI the future of routine dental radiology? And maybe more to the point, how long until a tool just like this one becomes a standard, indispensable part of your daily toolkit?